All right, my knee hurts, and because my knee hurts, I'm gonna first off straighten out my camera because I'm not sure that's straight at all. That's probably a little better. Because my knee hurts, you get to benefit from me explaining and talking about injuries. Now, you're gonna hear everything under the sun nowadays on social media about injuries, and you'll hear everybody tell you they know exactly how to fix it. Not really the case. Lots of people know things. Not everyone knows you, your history, and how you got hurt. So let's talk about it really quick. By the way, before I go any further, this is not medical advice. This is not medical information. Insert any medical related disclaimer. This is not anything related to you being hurt. If you are seriously hurt, go seek out an expert for official expert advice, medical advice, whatever it may be. I am not a medical expert, nor am I providing any medical advice. I'm giving you some information and tactics I use on myself to help myself. So, when I get hurt, let's just talk about this. There are two ways typically you get hurt. One is you did something. You stepped weird. I stepped weird and I rolled my ankle. I stepped weird and I fell on my hand. There is an acute injury mechanism. So mechanism injury, MOI, a very acute one. You can pinpoint it. Oh, injury, fell, something happened. I was running and I heard a pop. Not good, something happened. An event, an acute action. Then there are these, I'll just call them non-acute actions. People typically always label this as an itis. It's not the case always. Often itises are common as non-acute actions. Something that builds up. My knee kind of hurts one day, hurts more the next, and all of a sudden I ran too much and I have a lot of aches and pains. I ran my marathon just fine. The next day, my knee's really sore. My tendon's really sore. That's a tendonitis. But that's not always the case. There can be specific things in there. For example, you could have irritation of a meniscus. Your semimembranosus or tendinosis attaches to your meniscus, and maybe that's pulling on it and causing an issue. Maybe you have a rotary issue at knee lockout at terminal knee extension. Maybe you have something going on with the fibular head. So there's a bunch of things that could go on, and let's just call that category non-acute. And we'll get to that in a second because that's kind of the fun discussion point. The acute injuries, muscle tears, ligament tears, I guess strains, tears, and breaks are kind of the big ones. Like, did you break your foot? It's point tender. There's an area on the spot. Oh, if my foot is broken, I'll poke it. I've broken my foot before. Just that one spot really hurts. You can go read online. There's lots of different tests, special tests people use and do. I've had people perform vibrating tuning forks on me, where they hit a tuning fork, they put it on my foot, and it vibrates and causes pain in that specific area. Well, I might have a broken something. Obviously, I go and get it actually x-rayed. Not always do stress fractures show up according to the acuteness of the injury, but point tenderness, really point tender, and maybe some swelling and whatnot. Then there's like the muscle strain and tear, where if someone were to move your limb around and you could, let's say a hamstring, well, you know when it's a tendon, you know when it's a muscle. But basically, you could have some aspect of someone can move you passively, it doesn't cause as much pain, versus an activation of the muscle then causes lots of pain because it's actively being pulled, and so on. I'm not going to dive into all these, but you can get the idea. The acute issue. There's an acute issue, something happens. Oh my gosh, oh no, not very good news. Someone then takes care of you. All the way from, breaks to someone hitting your bursa and you get a big swollen bursa on your elbow. Those are pretty typically easy to identify because they happen. The ones that are tough are those non-acute ones, like, my knee. Swelling, pain, discomfort, can't do certain things, warms up at certain times, feels better at other times. So you got to ask yourself, have I had this before? And the answer is yes, I have had this before. What are some things that typically cause that issue? And then what are some areas that you can better understand the issue? So the first thing I do when I have an issue is I try to seek out an expert in the area. And I'll say, hey, expert, let me explain what happened. So I give them the entire background and thought process behind what I think it might be and what occurred to it. Too many times people just tell the expert, oh, my knee hurts, and they fail to mention that they had been squatting a whole bunch more the past week, or they went on a hike on a whole bunch of uneven surfaces, or they did something where they were playing basketball outside and at a higher level of impact. The whole story and narrative, when it isn't acute, tells a really important story because that's typically what led to the non-acute issue. So you need to know what's going on. So understand like when I have an issue, I understand my own history. Oh, wow, that happened. Okay, cool. What do I think it might be? And I put together a thought process, and some people aren't as versed in injuries in areas like this that I am. And so they might just not have a hypothesis. They just go tell their expert, hey, this is what happened. These things took place. This is what occurred. And can you help me? Because that's really important, is the whole picture. What I like to do is, I'm a weirdo and I like to learn this stuff and think I can solve it for myself as quickly as an expert might. Is I'm part of my hypothesis, I'll pull up the anatomy of the area and I'll look at all muscle origin and insertion sites around the area, because there's a classic example. You might have a rope wrapped around someone's back and you pull them. Ooh, that hurt my back, you pulled me. But someone pulling the rope is way over here. It's not actually the back that hurts, it's something pulling on that area. That's very classic. People label that maybe as fascia. It's really not, or soft tissue, fascia. Muscle tightness, it's a non-specific thing because it could be a multitude of factors, but realistically, it could be one area affecting another. Ooh, I have hip tightness, my hip musculature is a certain way, and it causes some low back pain. Classic example. Many different examples similar to that. Whether the tissue is changing the gait and how you're walking, and that tightness is causing irritation and pain, or there's a direct link to it. This part of the area is like less scientific. It's a little more hard to pinpoint, and so you'll have certain practitioners who are really, really good in this area and they know the ins and outs of it, and certain practitioners who may not. So that's why when you go see one person versus another, they might have one approach versus another approach. It's not like either approach is wrong. They are just different ways through trying to uncover the correct answer. That is to help myself with my issues. So I've seen people from chiropractors, massage therapist, physical therapist, whomever it might be who I think can help me. So we have this mystery thing going on. Do I have a history of it? Did the history occur? Like maybe, for example, I had knee surgery in this knee, or maybe I had a tear in the past, or I had some acute injury where I broke something, and something could have happened where it caused a degeneration in the knee, and maybe there's less cartilage in the area. So it can be explained by, oh, you did something that was way too high in loading acutely and causes some impact. Maybe you have, like, sometimes people have torn meniscuses that don't get surgery, and the meniscus can get out of place, essentially. You could have weird things like that. You could have tissue tightness causing maltracking of the patella. And because maybe you had surgery, which I did on this knee, not the other knee, and that causes some tissue tightness or some scarring in the area, which loses some of the patellar mobility. So point is, I have an understanding of the anatomy in the area. I have an understanding of the distal anatomy, the proximal anatomy, structures that might be interacting on it, monoarticulate and biarticulate muscles, muscles that cross one joint, muscles that cross two joints, like your hamstrings cross two joints, a lot of elbow issues, a lot of muscles at the elbow, like hand digitorum and flexors and stuff, cross two joints. Your biceps long head is biarticulate, your shoulder and your elbow joint. So you have things that are interconnected. So I try to understand the anatomy of what's going on. I try to understand the mechanism, the type of pain. Does it hurt when I sit? Does it get elicited by a certain movement, by a certain action, and a position? This is information that I will tell the expert, hey, expert, this is when it hurts. This is how it hurts. What does that mean? What might it mean to you? These are some sensations I have when I do it. Oh, when I do this, I get numbness and tingling down my leg. Classic nerve sign. Versus, oh, I have a really sharp pain in the muscle belly. Or, ooh, at the insertion site of my knee for the knee tendon that really hurts. Or I have something inside the knee joint that I can't specifically point out. All these things matter for me when I begin to look at my injury and then make a game plan going forward. Often people claim, oh, you just have to go, full range of motion or whatever, or you have to do no range of motion, or you have to do this. But that you can't have a plan until you understand the problem. And so the first thing you have to really try and do. For me, what I try and do is understand what the heck is going on. And understand my limitations. Oh, I know a lot about certain areas. I know less about other areas. I had a foot issue. This foot issue was super bizarre. Never had it before. Didn't understand how it came up, how it occurred. It ended up being like my shoes were too tight and I had an impact. Someone stepped on my foot and it caused potentially some weird rotation and it got locked up. I played 2 days on it. The third day, I couldn't even get out of bed and walked. An expert reached out to me. This individual told me to do some exercises, and next thing you know, in a week and a half, it's like perfectly normal. And this was a foot I physically could not walk on for 2 days. Like, it was so bad. But I knew there wasn't like a massively traumatic issue because I didn't get stepped on that day and then my foot like fell off. It happened a couple days later. I had some residual soreness leading up to that, or some lingering soreness leading up to that issue. So when it comes to understanding my injuries, I have to understand the history. I have to understand the limitations in both physical things I do. Oh, I'm limited in how much capacity I've had running and sprinting, so I went and ran and sprinted, and oh, now I hurt. And also limitations in terms of anthropometrics and biomechanically. Oh, I don't move a certain way. I don't like to move a certain way. I have certain limitations in ankle range of motion and how that affects everything else. And then again, is there a change before and after my certain issue in my knee? Was I mobile before? I'm less mobile now. How is the pain elicited? When is it elicited? How does it feel? So on and so forth. With my hypothesis around this knee is that there might have been some excessive loading. I was playing outside, and there might have been some tightness in the hamstrings, which can pull on certain areas of like a meniscus or something. And it's a very short-lived pain. Well, it's not very fun at the time, but very manageable pain. If I had to play a game today or had to practice today, I'd be totally able to do so. But there might be some residual knee swelling in here at the moment. And so is it wise to try and push through that? Is it wise to squat? What caused it? Was it a hamstring? Because the hamstrings are being loaded in certain exercises I was doing that were different, unique, and new, and that caused some jarring in the area. Is it a mixture of all the above? Was there already some swelling in there that was going on? Maybe from an impact, maybe just from playing. And then I had this hamstring issue go on in there, and because the joint capsule is only so large, when you have multiple factors of swelling causing stuff in there, there becomes naturally less mobility within the joint because it has some level of compression and tension in it because of the swelling. Is that going to cause the issue? So I share this message with you all who might be listening to this because I've been hurt many times in my life. That happens. The most important thing is to find a way to get through whatever is occurring and manage it appropriately. If you want to help athletes, you have to communicate with experts to make sure they get the right care. You yourself may not be an expert. I am trying to solve stuff for myself. This is my opinion, my anecdotal observations based on my interactions. Again, not medical advice at all. I'm not a medical expert. I don't pretend to be a medical expert, nor do I give this as a means to persuade someone medically. I'm just sharing what I have gone through and what I have learned through my experiences that maybe can help future me or whomever it might be interact with an expert or a provider or someone who is an expert in a way that you give them the full synopsis of what's going on to give them the best and most correct information they can have in order to provide a plan and action, because injuries are not fun, injuries are limiting, injuries are not enjoyable. That's my more than 2 cents on this topic. I hope it makes sense to you all listening at home. A little short recap, if by any chance you're still listening. Acute, non-acute, understand the anatomy, understand distal and proximal anatomy, understand what you had been doing the past week, 2 weeks, and month. Think of anything that might have been impactful that didn't cause any acute trauma at the time in the past maybe 2 weeks, anything out of the normal, ways that this pain gets elicited, and how it's reproduced. Are there certain times of day? Is it after certain activities? Is it before certain activities? Giving the fullest picture you can provide the most amount of information for that expert to make the correct plan for you so you can get better. Appreciate y'all and hope you enjoyed.